The number of new cases in China's Hubei province has fallen for a second straight day. 2,015 new cases have been reported over the past 24 hours, and that is down from a peak of nearly twice that number just a week ago.
So that brings the total infected across China to more than 44,000. The recovery rate is also on the rise. More than 740 people have been discharged from Chinese hospitals over the past 24 hours, but 97 additional deaths have been reported, taking the nationwide toll to 1,113.
China is still increasing measures to prevent further spread of the virus as more and more people return to major cities for work. In Beijing, the government has told residential areas and villages to apply strict health and safety protocols.
Residents and vehicles can only enter and leave with authorization. The government is also staggering the return of students to schools across different regions to try to stop further community spread.
Our China correspondent Lynette Lim joins us now in the studio. Lynette, China is reporting a drop in numbers. Of these infections, is it too soon to really say that we're optimistic that we're seeing numbers coming down?
Well, these are being read as largely positive trends, but then a lot of members of the Chinese public, Chinese netizens, they still express doubt and distrust over the official data. And this is compounded by some disturbing reports we've seen about citizen journalists, I beg your pardon, being disappeared. You know, these people were reporting from the ground in Wuhan and Hubei, and they have disappeared. This is also compounded by a report citing anonymous medical sources saying that by mid-January, 500 medical staff in Wuhan had contracted the virus. And then doctors and nurses there have been told to not reveal the full picture to the public. So this further compounds the issue of trust, public trust with the government. And this makes them, less optimistic, even though the trends are showing to be positive right now.
Well, obviously, education has been disrupted because of COVID-19, and we're hearing that, China is going to be staggering the reopening of schools. Tell us more about, the plans for them.
So the staggering and the delayed reopening differs from province to province. It also differs between schools. So middle school, high school, universities, they all have different schedules. And a large part of this program is online learning, because people can't go back to school. Online learning, the government has provided 24,000 courses on 22 online platforms. Students who don't have access to internet, people who live in rural areas, there's a dedicated education TV channel they can watch. But then this still begs the question of how effective online learning, television learning can be, how effective they can be, vis-a-vis face-to-face classroom learning. So that's a question that can't be answered right now, and it's probably the second best solution that we can have.
Lynette, we're also hearing a rather troubling piece of information that perhaps there's inadequate medical care for people who are suffering from other illnesses. What do we know about that?
Yeah, for some time now, we are seeing distress calls and pleas on Weibo, China's Twitter, China's social media, people saying that their mom or their dad, they have caught cancer. And because these specialist hospitals, especially in Wuhan and Hubei, have been requisitioned for use as designated virus hospitals, the medical resources there, the staff, they're fully stretched, and they can't entertain patients who are non-COVID-19 patients. Another aspect to it is that because of the lockdown in these cities, logistics is difficult. They can't get access to medical supplies that they need. And these patients also, not just emergency cases, we are seeing cancer patients, epilepsy, asthma patients, also dialysis patients. They can't get access to regular treatments now. I'm sure this is a teething issue that the government is looking into, but then it also points to the dark side of this rather swift and drastic measure that the government has taken. On one hand, it's being lauded as, very decisive, very good, but on the other hand, it again plays to the idea that this is an authoritarian government where individual lives are less important than the collective good.
Well, whichever way you look at it, they face a very dire situation indeed. Lynette, thank you very much for that.